to know is that why Ayub is so interested in this topic. He says it's very important and he should join, and he has to join. So there's a lot of learning to do for Ayub and equally for me and you back at home. So make sure that you join us this morning. We want to understand the importance of antenatal care, because it's pretty much important that you get it all well. The process of course, at that point you get pregnant, you know, the process all the way up until you give birth. Of course, ensuring that you give birth to a healthy baby, and equally you as the mother, you know, maintain that healthy state. So joining us this morning is Lilian Mutua. Thank you so much for having a time to be with us. Of course, the County Health Promotion Coordinator, and CC, of course, right here in Nairobi, right?
Yes.
Good to have you. And of course, we're looking forward to learn so much. So, you know, the importance of antenatal care, when it should start, because most of the mothers do not know, have no idea of how, of course, they should go about this process, and most importantly, at what point they should start. And like what Ayub said, the role of the man out here, because many a times you'll see the man, you know, pulling aside and saying that this is not my thing. I'm probably not involved. At the end of the day, I'll just provide. And, you know, they don't focus so much so on, you know, just getting to understand the process of pregnancy for the mothers and the babies out there. So welcome on board. And of course, we'll start off with that pertinent question. At what point should we start the antenatal care, even as we get to understand the importance of it?
Good morning. Thank you very much for having me. It's very important that the first signs that a lady gets, either missing her periods or she feels her body is not normal, because at times when you get pregnant, your hormones are going to fluctuate and they'll bring some discomfort in your body and you'll feel like you're not normal. That is the first time that you should go for your antenatal checkup. First of all, just to confirm that you are pregnant. And mostly because unless for the ladies who don't have regular periods, if you know that you've been having regular periods, you have had unprotected sex, and you miss your periods, then that is the first sign that we should just tell you, you should go for a checkup and confirm whether you're pregnant.
They would probably argue that back then, you know, some of these checkups were not necessary, and even the antenatal processes were not necessary. And still we could see our mothers who, you know, sort of gave birth to healthy babies. They were equally very healthy. I mean, what's the difference back then and right now?
With evidence from statistics and data, we have seen that the pregnant women at the moment go through a lot of, some go through complications, others get conditions that they were not having because of the pregnancy. Yes, beforehand, our mothers didn't go for clinics. I know that even people like our grandmothers never went for any clinic, and they had their babies. But not every woman, even at that period, got a safe pregnancy and went to term and had healthy babies and the mothers alive. So why we insist on having the antenatal clinic follow-up is because we want to have a healthy mother, a healthy baby, and a healthy pregnancy.
And of course, when you talk about the pregnancy, by average, it's all about the 9 months period, and meaning that you need to be up to task when it comes to the monitoring process of how this is going to be unfolding or is going to be happening. But again, what is the role here of the people involved? To be specific, let me cherry pick the husband or the father to that child, whether he or she, and how important is it in the contemporary society?
Let me first say that in the medical field, we don't want to term as the male partner of the lady who is pregnant as a husband. We call them partners because we know that there are also single ladies who get pregnant. We have ladies who are married who also get pregnant.
Right.
And at the meantime, even in our society, we are seeing that girls are getting pregnant at a very tender age and they are not married. So what we request is there should be male engagement, male involvement in any single pregnancy. First of all, just to give the psychological support. Secondly, for acceptance of the pregnancy. We've seen people saying that you have unwanted pregnancies. There's nothing like unwanted pregnancy. The term is unintended pregnancy. You did not intend to get pregnant, but you found that you're pregnant. And for pregnancy, it takes two, the male and the female. But even by our socialization and our culture and even our backgrounds, everybody thinks that pregnancy is about the woman. It's only that the woman has to carry the baby for the 9 months.
Okay.
So there's a role of the male and a role for even the community and the family. And like you've asked for the man, right now we are doing what we are calling the nurturing care, where if we have two people who are intimate and there could be a possibility of the lady getting pregnant, before you engage in any sexual activity, first you should know, are you going to get a pregnancy out of the sexual activity? Or do you want to protect yourself and not get yourself pregnant? And also we are saying that when the lady is pregnant, the man is pregnant too, because he's the one who is going to make the lady pregnant. So the pregnancy carries the two, the male and the female participation. I've said that in natural care, we are bringing the man on board because most of the time we've even seen through our cultural practices that the male feel the women take over the children.
Yes.
And the children are more closer to the mothers. This is just through psychology and through telepathy and emotions. You'll find that when a mother is pregnant, at times she talks to her baby in the womb.
Right.
You find even at times they'll play music that makes them feel very comfortable, and that also makes the baby relax. So we are also teaching the male to come on board. When the lady is pregnant, the man should even touch the belly of the lady, talk to the baby, let the baby have that emotion attachment to the man. And even when it comes to the clinics, we are encouraging the men to take a day off. Because when you're going for a clinic, you won't go for a clinic from 8 a.m. up to 5 p.m.
Right.
So the man should also excuse himself if he's working to accompany the lady to the clinic, to have the education that the ladies go through, and also make informed choices. Because the choices comes with also some social understanding, some emotional understanding, some medical education. You even have to make choices of where you want your lady to deliver, how much it's going to cost you, maybe have one of you on board to have the medical insurance cover.
Right.
Yeah, and such things.
Speaking of that, Ayub, allow me to ask this, because then as women, we know that it comes along with a lot of emotional changes and, you know, mood swings and all that. So in the event that maybe a man actively wants to be involved, but then there's that feeling that probably, like they would rightfully put it, sometimes you really do not want to see this person.
Don't
in such
cross the
special
borders.
cases, I know, don't cross the borders. So how do we, like, how do they get to approach that? Because men will tell you sometimes it's really frustrating. You want to be there, but she just wouldn't let you be there.
I think it starts from far beyond the time that the girl or the lady gets pregnant.
Right.
So there needs to be conversation even before pregnancy, and you have to show your emotional attachment to the lady who is pregnant before all the mood swings come on. The mood swings do not come immediately. They come later.
Okay.
So if you are there to give her a lot of psychosocial support, a lot of emotional support, it really goes a long way.
Okay.
Okay, given that, let me again look at it from the flip end of the question that Linda did pose. And this is where now there is complete neglect from the man in not even caring about or sharing that responsibility when it comes to the clinic, of course, visits, when it comes to the psychosocial support you just mentioned. And that literally opens up a psychological warfare of of course, partner carrying the pregnancy. Looking at that again, do you come in and give some sense of counseling because she feels abandoned and alone, isolated in this case?
In fact, that's why we are saying that we are introducing the male engagement in our antenatal clinics. We want the male partner to walk in with the lady for the clinic so that they get a lot of counseling, a lot of support. When you look at our statistics, even in the antenatal clinic, you find that we have what we call the mother-to-child transmission of HIV, where we get the women tested for HIV. But you'll find that when we request them to bring their male on board for that testing, the partner does not want to agree. He will always say that so long as you've been tested and you're negative, it means I'm also negative.
Right.
But we know that we have couples who are disconduct. We find that one of the partners is positive, the other one is negative. And there's even that counseling, that process that we take them through so that they are able to understand themselves. We've also seen ladies who are tested during antenatal. They start taking the antiretrovirals and their partners are not aware because they think that once the man knows that the lady is positive,
yeah.
then he's going to kick her away or run away from the family. So there's a lot of engagement we do. We also do what we call the individual birth plan. You can remember, like the other day, we had a story on media where a lady gave birth when she was in a taxi,
Yes, in a taxi,
somewhere
yes.
in the street.
Yes.
And it took time for them to understand a lot of, to figure out what to do. But you see, when you're, when you're a man, and you're the person who is the partner to this lady, you will even be taken through on what the lady is supposed to have every time she's walking. Like every other woman who is pregnant needs to have her card with her, needs to have her insurance cover with her, needs to have a birth pack, which contains gloves, a towel to carry the baby, and other necessities, a ligature for clipping the cord, just in case that she delivers out of hospital, and even have an emergency number that can be called. So there's a lot of preparation, a lot of education, a lot of information that the man will also be empowered to. And even after delivery, we request that the fathers also carry along the baby to the clinic. They should understand the immunization schedule for the baby. They should understand why breastfeeding is important for the baby. They will be taught how to support the mother even for breastfeeding. So we don't start when the baby is born. We start way back so that you are able to understand the journey all through.
All right, that
Okay,
is, after that is postnatal. Yes, go ahead.
Yes, there are motivational factors to it, by the way. I have witnessed, sometimes you go there, there's a queue. At the event that you're coming with a man, then you're allowed to...
First priority.
You're given first priority. So there are some of the things that actually that are good enough that come along with that, and I think it's motivation enough. So at least this man would want to come back again and again. But let's just, as though we are coming back to the drawing board and understanding what are the key components, crucial, vital issues that you will be, of course, introduced to in the event that you are now, you've decided that, oh, I've gotten these signs and I think I'm pregnant, and then you go to the clinic. What are the key things that will be addressed medication-wise, nutrition-wise, and generally what you've said, care at this time?
For a very healthy pregnancy, once you have information, especially if you have had a previous pregnancy and you've gone through the antenatal clinic, we always say that you should have a planned pregnancy. So the information about the pregnancy, the education about the pregnancy starts way beyond you're pregnant. And for both the male and the females who are still young, who have, are willing to start families or to get pregnant, it is good even for you to visit a clinic once you decide that you want to get pregnant. Why do we do this? There are some medical conditions that the doctor might learn that you have, and he'll be able to guide you on how to go about it. There are other factors that we are able to look at. We know that when a lady is pregnant, there are two sides of it. Either you survive well, out and deliver well, or you could also have the pregnancy and complications, still deliver well if you are under medical a medical process.
Okay, because we have also the pre and the post here, but we talk about what's intermediary here at the center. But equally, again, there are specifics or specificity that you also give as clarion call, perhaps to employees at the places of work and, of course, to their bosses in the event that you need to pass on the message, because this is just a broad topic where we have participants from all across, because pregnancy does cut across, it doesn't have ethnicity, religion, or because it's a human aspect and human element universally. So what's your message, and how do you code it? How do you convey it to the institutions of, say, government or NGOs, or even to the corporate sector, to ensure that it cuts across and that this is the message when such processes do happen?
Well, what I'd firstly like to rally a call on is that for a healthy person, they will give you maximum productivity at work. And when someone is not healthy, then you'll have man-hours lost, because this person maybe will be going for sick-offs and such. And as I've said, when a lady is pregnant, they need support from all quarters, including at workplace. there should be acceptance of that lady that she's pregnant. Learn to be able to talk to her. Let her tell if it's her supervisor or it's the person who is head of the department what she's going through. Allow her to get offs to go to clinic. And when she's not well, don't say that she's taking too much offs. Let the doctor be able to guide you.
Okay.
Because pregnancy only takes 9 months, and maybe then she goes for maternity leave, and she's back. And if you show her a lot of support, a lot of emotional support, psychological support, she is able to walk through her pregnancy very well. And we'd also like to encourage at workplace for the males who will come and ask for a day off to take their partners for clinic, let it be accepted so that they can walk their walk together.
All right. The ultimate look is to have a positive, pregnancy situation, or maybe a positive pregnancy world where everyone will enjoy the aspect of motherhood, or the journey of motherhood, or the journey to getting to motherhood. As a country, or generally globally, this has been a very vital fight, and the biggest question would be, have we made strides in terms of ensuring that, of course, when we have very many women coming on board and embracing that antenatal care and, going to clinics at that early stage, have we reached at a point whereby we can confidently say that this has hugely helped in, the reduction of stillbirths, reduction of pregnancies with complications, and all these issues that come along, with parents, or maybe with mothers failing to get that care?
We know that we have really tried. We remember that from the early 90s, we were doing what was called the focused antenatal care, where every lady was requested to have 4 antenatal clinics. But right now we say you can go we are back to, you can go for the clinic as many times as you wish. Because when we say the 4, we saw that especially in our country, people just looked at the 4 clinics that they should come, and some of them were coming very late, because they were just saying that they need to make the 4 before they go for delivery. But right now we are saying, let us start very early. You'll be guided by the nurse or the doctor or the practitioner who is following on you. We know that we have very cardinal components that we look at. First of all, we need to know your medical background or history.
Yes.
Then there are tests that we are able to run. We will know your blood group just in case of an emergency, or maybe where we found that people have a rhesus negative, a blood group, and their husband has a positive. So we really need to see this, because some of these are the issues where you'll find that if a lady is not well managed, she can lose that pregnancy and lose the subsequent pregnancies. We are also looking at diseases such as syphilis, HIV, and see how we can go through with this. At times we even get a patient is having TB and she's on medication, but she's gotten pregnant. So how are we going to take care of that pregnancy and the baby who is unborn? So there are many parameters we look at. We know that some ladies get hypertension, which is induced by the pregnancy, and someone has never had hypertension before. Some even become diabetic. And there are many issues that can go around when a lady is pregnant, according to their health.
Okay. Well, as we finalize, one of the most important elements that also will have effect on your docket as the, of course, coordinator, the county health promotion coordinator, is about the issue of universal coverage. Many people, of course, pregnant mothers are not universally covered, neither can they access the NHIF or the private insurance companies in the country. That again brings about the shouldering of the burden of paying the bills at the hospital. So what policies and measures is the county undertaking specifically for, of course, people below the line so that they can access healthcare at that crucial time?
We are encouraging our public to make sure that when a mother is pregnant, she either is covered under NHIF or Tunza Mama, which are insurances which are you are able to afford. Because if in a month it is 500 shillings, I know that maybe some of them are financially disadvantaged. But when you look at 500 shillings per month, that is about 10 shillings or 15 shillings in a day. So you're able to save that. And it goes a long way, because if the partner is having the NHIF, it covers him, the mother, and the children in the family. If it is the Tunza Mama, this is a package that will go up to 2 years of birth of the baby. So any medication that is needed, any care that is needed for the mother, they're able to be brought on board.
Any special, of course, search for, you know, adolescent pregnancies, because then they're very common in the country, and that is something that we can't rule out. Of course, not in, they're not into NHIF, they're not into all these programs. So how does the government approach it in such a scenario?
I know that it's been a bit difficult because for NHIF and other covers, you need to be 18 years old.
Yeah.
Yes. But we have said that if the parent has the insurance, the NHIF or any other medical insurance, they are able to ride on that. We are also able to talk to the culture and social services so that this is taken up by the social workers to see that everything will be covered in the hospital. Apart from even the pregnancy and the clinic and the delivery, we are also looking at return back to school for the girls who get pregnant. We are also doing a lot of education and awareness to both the churches, the schools, the legal advisors, and many other actors in health, so that we can start guiding our girls so that they don't find themselves pregnant at a very tender age. I know most of it goes because they don't have informed choices. And when it comes to sex, we have not put a platform even in the families to talk about it.
Okay. Sure.
Well, Lillian Mutua, County Health Promotion Coordinator, Nairobi City County, thank you for coming on board. We end it on that note, despite, of course, the other important element that do intertwine with the topic that we've just talked about, the pre and, of course, the post. And it's equally important that we are lovely to have had you. And then, of course, all the time, you're welcome on set as we discuss important elements that regard matters health in the country.
It's very important that we take care of this, like it has been put rightfully. This, in a huge way, has worked towards reducing maternal deaths or maternal, of course, mortality at some point in time. And I think it's very important that we take advantage of some of these programs that have been presented by the government that are fair enough for the mothers out there. But most importantly, biggest lesson of the day, men kindly get involved. And that's where we wind it up. We say thank you so much once again, Lillian, and of course to you, the viewer, for keeping us company right from the word go up until now. My name is Linda Alelam. We see you again tomorrow, same time, same place. Do enjoy the rest of your viewing.